Please write a prescription for a male, aged 36, presented with pain in the lower back since 3 months. The diagnosis is made as Kadishula, or the modern diagnosis is intravertebral disc collapse L3, L4, L5. So please write a prescription for this. Either you can put in the chat box, or you can unmute and you can ask. You can unmute and answer as well.
Participants, I have made the unmute button available for you, so you can unmute yourself and speak, or else you can put it in the chat box, as our speaker had said.
I hope all of you are accomplished practitioners, so you might be dealing with such cases on a daily basis. So when you get a patient with low backache since 3 months, and the diagnosis, modern diagnosis, intravertebral disc collapse. So please tell me what prescriptions you will give.
Sir, we have an answer in the chat box.
Sallaki tabs and Asana Sapta Kashaya. Okay. Can you please tell me why you selected these drugs and you may please unmute and you can share your opinion, or you can put in the chat box.
Dr. Kanita?
Yes, ma'am.
Yes, you can answer.
And please tell me the rationale.
Sir, pain
Okay.
and it is maybe due to sciatica. So
The selection of drugs is based on the patient's condition is sciatica. That is why we have prescribed Astra Saptaga and Selaglutide. Okay. Any other prescriptions? Let us see 2 or 3 prescriptions more, then we'll go to the next slide.
Participants, you can write it in the chat box.
Please don't consider this as a Viva. This is a particular one-on-one discussion between practitioners. I cannot say that any single prescription is wrong, is it? In Ayurveda, you can have your own opinion, your own yukti, and you can treat. So every prescription will be right in its own sense. So this is not like something judging your prescription capacity, nothing like that. We just want an active discussion, that's all. So please come forward and give me 2 or 3 more prescriptions.
Yes, please participants, without any hesitation, you can do. Okay, no issues. You are welcome.
Yogaraja, Gugulu and Abhayarishta, okay. Dr. Nalini, could you please tell me why you selected these drugs?
Yogaraja Google for pain relieving.
Okay. And Abhayarishta?
Vatanoloma.
Any other prescriptions? Okay, I will give you another case. Maybe you are fed up with treating back pain, so this is another case. A 40 years old female presented with pain and swelling in multiple joints, occasional fever since 2 years. RI factor is positive and recently done ESR is 45 mm. So kindly prescribe.
Sir, Amavatari Rasa.
Okay, then.
And we can do Svedana, sir.
Svedana. Okay, why Amavatari Rasa?
RI factor is positive, no, sir.
Okay, so RI factor is positive, so Amavatari Rasa. Okay. So now my next question is this model of prescription right, or should we think about some other particle? methods of assessment and prescription. So usually what we follow is something called as a pattern-oriented method, where when we get a pattern of modern diagnosis or a pattern of modern what you call presentation in the patient, we select an Ayurvedic medicine. So a modern diagnosis A, somebody told RA, and it is Amavada. So we select a particular medicine that is Amavada Rirasa. There is another pattern that we usually follow is Ayurvedic diagnosis X is equal to Ayurvedic medicine Y. For example, Ayurvedic diagnosis Vadarakta is equal to Manjishtadi Kashaya. So this is what we have been trained upon and what is imprinted in our mind. I'm going to tell a different approach today because I also we were also when we studied we were also trained by most of the teachers in such a way, and at least 2 or 3 of the teachers had a different opinion, and they actually lit our minds up. So we are having a different approach now, and we are getting very good results in the practice as well. So the question is, we are blindly following the modern pathway where in modern they have a specific disease is equal to specific set of medicines, but they don't take into consideration the patient factors. For example, what type of body or the prakriti the patient has. It's a lot of things. But now the modern medicine has started identifying lacunae in their approach. So they also now feel that there is a need for personalized medicine. So they are also behind personalized medicine now. So let us see how we can tune our approach. So the first question is whether the Ayurvedic diagnosis is only about naming the disease. Can I have any input? If yes, you can put Y in the chat box. If no, you can put no in the N in the chat box. Is just Ayurvedic diagnosis just about naming a disease? If you support it's okay, then you put Y in the chat box. And if it is no, then you put N in the chat box. I got one N. Okay, 2 N's. Okay, so can you please tell me how it should be? Some of you who have put N, can you please unmute and tell me how it should be?
So there are many rogas which are not named by our.
Okay, okay. So even in the named disease, is what you call the name enough for prescribing? That is my question. Suppose, for example, Vadarakta is there in our textbook, and there are a lot of medicine stored. So you write Vadarakta. Is that name enough to prescribe?
No, sir.
Then what all things we need?
We have to assess the Prakriti and.
Okay. So all these things, see what I am telling is all these things, the technicalities we will always tell and we will always write in exams. But in real practice, uh, are we doing that?
Hello, sir.
Yes, please.
Sir, it's not related to name because whenever we get a patient, each patient is different and their hetus are also different. So according to that, first we have to take the hetu. Then first we have to take which complaints they are telling. According to that, we have to select which one is more vata, pitta, kapha, like that. Then next we have to select the dusha and which dusha is affected. Then next it is Avrodhajanya or pure Vata. Then last which is Pradhana Dosha. According to that and Anubandha Dosha. According to that we have to select the medicine because nowadays our granthas are mentioned so many diseases, but nowadays so many diseases are which are Anukta Vadis, so it will help us to uh, make a diagnosis.
Yeah. You are right. So that's why this pattern oriented method where sciatica is equal to Yogaraj, such type of approach may not be beneficial always. If you write such prescriptions in 100 patients, some 30% of them will get good results, and other 70% may not get proper results. So how we can approach this in a different angle? That's what we are going to discuss. So all these logas you might be knowing: Vigaranama, Kushalona, Jihriyat, Kadajana, etc. So what Charaka in short he says is we have to look at the Vigara Prakriti, what type of Vigara it is, and Adhisthana and other factors related to the disease, and Samuthana, that is a Nidan, as she rightly told. I don't know the doctor's name. Could you please tell me your name, please? Just now you.
Dr. Ujjwala sir from Bangalore.
Okay, Dr. Ujjwala. Yes, you rightly said it. So that the specificity of Nidana is very important in prescribing. I will give you so many clinical examples throughout my session now. So this sloga is very important. Tasmat vigara prakriti adhisthana antaranica samuthana visheshansha buddha karma samadhi. So that's why Chakrapani says that Jwara, Rakta Pitta, etc. Only the naming is not that much important. Adhisthana Antarani, Asya Antarani, etc. So we have to see how this disease process was initiated in a patient's body, in what substrate this disease is happening, and what are the characteristic features of the disease. Then only we can start prescribing the medicines. So that's again somebody told now itself that there are a lot of diseases that are emerging, new diseases emerging, for which we don't find quite or exact equivalence in our science. But still we can treat. That is what Susura says, Nasti rogo vina doshet. Yasmat tasmat vijakshana. Anuktam abhidoshana. Linger vyadhi ubhajaret. So you might be thinking I am telling a lot of slogas and this class will be boring. No, it's not. It will not be boring. The slogas will end here. Now, from now onwards, we will only start discussing clinical particular application of our principles. So what is special about Ayurvedic approach? We usually we boast about that there is something unique about Ayurvedic approach, and we tell a lot of these things, Dusham, Desam, Balam, Kalam, etc. But ultimately, while we prescribe, we end up doing the same thing. Okay, psoriasis is equal to Mahamanjishtadi Kashaya, or gout is equal to Manjishtadi Kashaya, like that. But that will not be what you call effective in a routine clinical practice. So Ayurvedic approach is always about dynamic assessment of the disease. So the Roga Avastha changes through the course of the illness, and based on the Roga Avastha, we may have to modify our prescription. So the assessment of the disease is always dynamic, and the diagnosis or the clinical method is not about identifying the name for a disease, but the diagnostic assessment is all about identifying the various therapeutic indicators in the patient so that we can personalize the treatment and medicines in the given patient. That's the important thing. And so that we should be able to tailor the treatment for each individual. And also, rather than prescribing one medicine and asking the patient to take these medicines for months along, we should be able, or we should equip ourselves to monitor the progress and modify the treatment at appropriate time intervals. That is again very important. So Ayurvedic treatment is not like a disease A is equal to a drug A. That is not the case. So before going into the Ayurvedic diagnostic approach, let us see what are the diagnostic models in modern medicine. So basically in modern medicine, there are two types of diagnostic models. One is called as the intuitive approach or intuitive model, and the other one is an analytical model. So intuitive model is just like you see a patient with psoriasis, that pattern is imprinted into your mind. So next time when you see that pattern, immediately without any thought process, you can identify that as psoriasis. So the rationality is bounded, it's very limited. And it's heuristic, so that it always depends upon your observational skills. And it is always about pattern recognition. You identify that pattern and you diagnose the disease. There is no much thinking into that process. So it is just like an unconscious thinking. But modern medicine is not like, analytical model is not like that. It's something called as a hypothetical deductive model where you have to deduce the things from the available evidences. So you should apply the concept of reasoning in that process. So there is an unbounded rationality, and you have to apply your reasoning skills. So this is the best model. I will tell you an example. Suppose you went for a picnic, and you are going to a mountain top. So there are two ways in which you can reach the mountain top. One is you can climb through all the pathways so that you will not miss any plants, trees, or any sceneries in between. Or else you can take a helicopter and directly jump onto the top of the mountain. So in that scenario, the second scenario, you will miss all the sceneries in between. But if you go through this process properly, then you will not miss any sceneries. It is the same way about diagnosis. But what happens is usually we go with this intuitive model. So most of the times we end up in a failure in assessing the disease. But when we come to Ayurvedic diagnostic models, we know these are the diagnostic models, Pratyaksha, Anumana, Yukti, etc. Usually what happens is we will apply all of these simultaneously in a patient so that we cannot what you call stratify or separate them from each of these things, because simultaneously we will get a Pratyaksha and we will apply Anumana and Yukti and all these things. But if you want to segregate that and analyze, then Pratyaksha is something like pattern recognition method. Anumana is what you call deductive reasoning, and Yukti is again deductive reasoning based on multiple factors, and Upamana is just like pattern recognition, where just like an example, cross to Shirsha. You see one cross to Shirsha, then next time you get cross to Shirsha, you will identify accordingly. So that is something like analogy. And Arthopodesa is mandatory for all these things, because what mind doesn't know, eyes cannot see. That's an aphorism in clinical medicine. If you don't know the theoretical knowledge of something, even if the patient comes to you with a particular condition and sits in front of you, you will not be able to identify, because you are not knowing that. So Arthopodesa is again very important. In the current context, we can consider Arthopodesa as our textual knowledge. So we discussed about therapeutic indicators in the patient. So what are the therapeutic indicators? So the first one is a disease workup. So we have to concentrate about the roga. So there, as somebody told earlier, we have to assess the dosha, roga marga which is affected, and the bala of the roga. So bala of the roga can be identified with the help of available nidanas in the patient, Purarupa, Rupa, and Ubadravas. Then also we have to assess the avastha, Sama, Nirama, Uttana, Gambhira, etc. avasthas. Next is the Rogi Pariksha. So even though for uh, for the ease of understanding we are discussing this separately, that doesn't mean we have to do it separately. In a routine clinical practice, all these things happen simultaneously. So we are not doing, okay, you come and sit here, let me first assess the roga, and afterwards then, okay, now let me assess the rogi. It's not like that. These process will go simultaneously, but for the ease of discussion, I am segregating it separately. So in case of patient workup or the Rogi Pariksha, we have to assess. Predominantly, we have the Dashavita Pariksha, but at least these factors are to be assessed. That is the Prakriti, the Satmya, the Sattva, the Bala of the Rogi. So here it was the Bala of the Roga, now here it is the Rogi Bala. So that includes the Vaya, Sara, Sampanana, Pramana, Vyayama, Shakti, Agni of the individual, etc. Then there are some extrinsic factors which is outside the patient's body. So that includes Kala, Desha, etc. If you take the Kerala textbook Chikilsa Manjari and you take Jwara Chikilsa, the first chapter, the first sloka itself says that you have to analyze the Kala before you start treating, because now it's summer, you give Ushna medicines in summer season. There are bound to be some problem in the patient's body. So if at all Ushna medicines are indicated, you may have to do necessary modulations before administering the medicine. So these are some of the extrinsic factors. So these indicators are mandatory to prescribe in Ayurveda. So let us see how we can go about this. So first let us see the Roga Pariksha. So even though I am telling it this in sequence, you can always do this simultaneously. I am not telling that you have to stick into this sequence, but this sequence I have made for the ease of discussion. So in that, first thing that we will do is we will collect the signs and symptoms available in the patient. So Lakshana Sangraha. And next we will analyze. So we'll detect, we'll apply reasoning and identify which is the predominant dosha available in the patient. And next we'll identify the dosha. And next we'll identify the Rogamarga or Srodhas. Then we'll also do some targeted questioning to identify the Nidana in the patient. And then we will analyze the Samprapti, and then we'll ultimately diagnose the disease, and then we'll assess the Roga Avastha as well. So first let us see the Lakshana Sangraha, how to analyze Lakshanas in the patient. So before going to the Lakshanas, could some of you tell me how you do it in your practice so that I will get an idea. So how you assess Lakshanas in the patient? I mean, we have all these modern terminologies. So once you get all these, once you fill up the history part, Next, how we are going to interpret that in Ayurveda?
Hello.
Yeah, please. Yes.
Sir, means I have to tell if one patient comes, I have to tell like that history.
No need. No need. Just I want to know how we will interpret this.
If the patient comes with Shula, I will assess it is Vataj. But
Okay.
next I will, according to Hetu, I will decide it is Avrojanya or pure means Dhatukshayjanya. If
Okay.
patient come with Daha, and if he has a pimples and it is very red and like he has a Daha more and burning more, then it will be Pittaj.
Okay.
And if it
So
is
I'll
a
ask you a question. I will ask you a simple question. It's don't please don't consider this as an exam. A patient came to you with a fever and a diarrhea. So now you have Jora and Adisara. Now, how will you decide what is the condition in the patient?
uh, actually I have to check the Hetu, sir, first. If
No. The question is, I am not going into the Hetu part. I'm just telling you because in Ayurveda there is a big confusion because Lakshanas and Rogas, the terminology used is same. For example, you get Adisara in Pitta Jwara and you get Jwara in Pitta Adisara. So a patient came to you with Jwara and Adisara. Now the question is, how you will identify which is Lakshana and which is the main Vyadhi?
that is little confusing, sir. But Jwara will be Pittaja condition, and Atisar according to what type of Mala Pravrutti he is getting. Like if he is getting sticky stool and it will be like kafach. If it is getting burning in a stool like that, it
Okay,
will be.
okay, got it. So assessing Lakshanas in the patient, the biggest confusion that comes into your mind is uh, Ajay has used the same terminology for the Vyadhi as well as the Lakshanas. So how to do that? So symptom terminologies may represent either the Pratyatma Lakshana or an associated feature. For example, in case of Jora, what happens is the patient has fever on most of the time of the day and patient got 3 to 4 loose stools. Then in such a scenario, Jora is the main Vyadhi and Adisara is an Anubandha Lakshana. But you think about another patient where the patient has around 12 to 13 episodes of loose stools in a day, and once or twice he got a mild fever. Then, in such a scenario, Adisara is the Vyadhi and Jwara is the Anubandha Lakshana. So, this is only one small example that I told. Like that, there are a lot of confusions that can happen in our practice. So, one thing that we can do is that to identify the Pratyatma Lakshana is that the complaint that made the patient to seek medical advice, the main complaint will be the Pratyatma Lakshana, but that will not be the case in every patient. So a clear-cut understanding is necessary. I will give you another example. We get a lot of patients with a migraine headache or sinus headaches. And when you take the history properly, you will come to know at least 60% of the patients will have Amla Vita associated with them. So here we have the reference of Sirashula in Amla Vita. So once you start treating the Amla Vita, then the headache will go away. But most of the times, 90% of the times, the Ayurvedic doctor will fail to identify because we are so much tuned with the modern approach. So Sirashula is equal to Vada is equal to Patyaksha Patyakshadanga Kashaya, Sirashula Adi Vajrasa. In that line, we'll think. So we will not think about the subtle pathology that is going on in the patient's body. So this has to be changed. This approach has to be changed. And another example, another theoretical example that I can give is we have Kasa in Rajakshma and also we have Kshayaja Kasa. Then what is the difference? So there in Madhavadana, in Madhukosha commentary, they clearly says that the Kasa in Rajakshma is only one of the symptoms. But in Kshayaja Kasa, Kasa is the main Vyadhi and Kshaya is Anubandha there. So you may ask what is the difference? There is a difference because if Kasa has a main Vyadhi, then the main therapeutic choice will be different. If the Rajakshma is the main Vyadhi, again the therapeutic choice will be different. So this has to be clarified. For clarifying that, in Charaka Nidana he says, Jnanartham yani choktani, Vyadhi lingani sangrehe, Vyadayaste tadatvetu, lingani ishtani na amaya. So wherever I have used some terminologies to identify the Anubandha Lakshanas of a main Vyadhi, in such scenarios you have to take it as a Lakshana not as a vyadi. That's what Charaka says. So how to elicit Pratyatma Lakshana? So a Pratyatma Lakshana can be any of these things. It can be the most severe symptom in the patient, or most persistent symptom in the patient, most chronic symptom in the patient, or a widely distributed symptom. For example, in case of an erythrodermic psoriasis, where it's a widely distributed symptom. So in such a scenario, that skin lesion or the kushta itself is the main vyadi. Or it may be a symptom of diagnostic importance. For example, somebody told Gridhrasi. So that typical gait itself is diagnostic of that. So these are only some of the important points. You can again think about multitude of ideas to identify a Pratyatma Lakshana. For example, Pandutvena Ubalakshito Roga Panduroga. So without that Pandutva feature, you cannot say that it's a Panduroga. So that is the one what you call approach that we can use to identify Pratyatma Lakshana. Then there will be some lakshanas which can happen as a Purarupa. For example, somebody told about the Kadi Shula. And if a patient came to you with the Kadi Shula and the patient says that occasionally I have radiating pain, then you should consider it as not as a main Vyadi or main Lakshana, you should take it as a Purarupa of Gridhrasi. So in Vada Vyadi again it's told Avyaktam Lakshanam Tesham Purarupam. So whenever some Vyadi is going to manifest, if the Lakshanas appear as Avyakta, you should consider it as a Purarupa. So in lot of scenarios, for example, in case of an eruptive fever, the fever on the first day may be a Purarupa of an eruptive pathology that is going to happen in the next 2 to 3 days. So we should not be a failure in identifying that. So some patients will come in Pururuvas and you should be very effective in identifying that. Another important example is Gulma. You might have got so many patients who come with chest pain and they might have undergone ECG evaluation, etc. And all might have come normal. So we know that upper GI pathologies can present as Hritshula. So there in Gulma, Hriday is told as one of the Sthana of Gulma. And you just give Leshuna Kshirabhaga, the patient will become okay. So in such scenarios, you should be able to identify that this is something which is manifesting as Gulma or it's Puraluba. So assessing Puraluba is again very important. I will give you a video. So look at this patient. So this is something like a hemifacial spasm. So if you go through Susura Samhita, he says, Yasyagrajo Lomaharsho Vebadur Netramavilam Vayu Urdham Tojiswava Todo Manya Anugraha. So this is told as Ardhita Pururuga. So here we diagnosed it as Ardhita Pururuga and we gave the treatment of Ardhita in this patient. And this is after the treatment. You can see the twitching has reduced markedly and there is only a mild twitching once in a while. So this is after 3 weeks of the treatment. So if you identify the patients early in the Pururupa also, you can treat the patient and prevent the patient ending up in a full-fledged disease. So that is about identifying the lakshanas. So whenever you get a set of signs and symptoms, you should clarify in your mind. There should be a clarity in your mind, which is the main lakshana or main pratyatma lakshana, in which spectrum of the disease this patient falls in, and what are the all other anubandha lakshanas. Then once you get that lakshana sangraha, you will have the list of lakshanas, and you will have the chronology, which lakshana got the patient, which lakshana presented first in the patient, and what are the other lakshanas that developed during the course of the illness. And then you should identify the dosha vishesha. This is again another important thing. So somebody told pain is vada, but that may not be the case always. I have seen a lot of prescriptions where a patient with abdominal pain, especially in the Nabi region, that means the periumbilical region, and this pain happens in the afternoon hours, and this pain occurs in the mid part of the digestion, and people write Hingua Jadi Churna, and the patient gets the symptoms aggravated because they don't have the concept of Pitta Shula in their mind. So a prescription of Datri Loha might have given better result than the Hingua Jadi Churna. So the only thing is that you should be able to identify the dosha in the given patient. So pain is not always vada. What Ajahn has told is a generic thing. that whenever there is pain, there is vada. Even Shuladigara, Acharya says vada is the predominant one. But to produce a Shula, vada should be there. But who is the inciting dosha? Who is the initiating dosha? For example, a patient will tell you that I have abdominal pain immediately after food intake. Then you should not give any vadahara measures. There you have to give kafahara measures because immediately after the food intake, kapha is the main dosha that is getting activated in the postop. We have studied Madhura Vibhaga, etc. So you give kafahara medicines, then the patient will start getting result. So how to identify the dosha? So the question is the common claims and comparisons. Are we right? For example, if there is inflammation, what is the dosha predominance? Can you please put in the chat box? Whenever there is inflammation, what is the dosha predominance? Okay. So I am getting the answers as pitta. Okay. Now I will give you 3 questions and you have to give me answers. A patient came to you with arthritis. Arthritis. So the presentation is pain and deformity in the joint. What is the dosha predominance? Vada, kapha, vada. Okay. Another patient came to you with a rhinitis. So first day of rhinitis, the patient has the running nose, heaviness in the head, and sneezing. What is the dosha predominance? Kapha. Okay, I'm getting a lot of kapha. I'll give you another question. A patient came to you with a cellulitis where there is reddish discoloration uh, and fever to the patient. What is the dosha predominance? Now I am getting pitta. Okay, so my point is that there was a so Hema Embar says inflammation can be any dosha predominance, and I agree to that opinion. So see, inflammation is not only pitta. It depends upon where it happens. Again, the dosha predominance depend upon in which stage of the inflammation you are seeing the patient. For example, even in the common cold, the first 2 to 3 days will be kapha predominant, then it will be pitta predominant. In the last stage, it will be vata predominant. You take a patient with meningitis, severe headache, it's vata predominant. So we cannot say always pitta is inflammation. That is wrong. This is one important thing that we have to identify is that whatever may be the modern diagnosis, the dosha assessment should be always clinical in the patient, in the clinical scenario. We cannot say always cellulitis is pitta. It's not possible because there are conditions where there may be vada association. There is that Aruna Varnada along with the cellulitis. So based upon that, we are supposed to prescribe our medicines. A patient with hypertension will come to you with a headache as a predominant manifestation. Another patient with hypertension will come to you as giddiness or Brahma as a predominant manifestation. And another patient with hypertension will come to you with heaviness of the head as a predominant manifestation. So in case of pain, you may diagnose Vada. In case of giddiness, you may diagnose Pitta Vada. And in case of heaviness, you may diagnose Kapha Vada. And the medicine will vary. You cannot say that Ashtavarga Kashaya is for hypertension in every case. That's not the case. So the dosha assessment, such an approach is not at all ideal in an Ayurvedic scenario. So inflammation is pitta, edema is kapha. That's actually rubbish and wrong. That should not. That type of practice has to be discouraged. So for understanding this concept, let us take an analogy. Let us take an example from real life. So let us imagine a pumpkin. So is the class boring? Should I reduce the speed or can I go forward? If I can go forward, you can put
Yes.
Y in the chat box.
You can go forward, sir.
Please put in the chat box. I want feedback from the participants. If I can go forward, if it is not boring, you put yes, yes, yes. Okay. Otherwise, what happens? People will go away from their phone or laptop. So I don't know whether they are there or not. Okay. So let us take the example of pumpkin. You look at this pumpkin. It's very tender. It's very green. If you weigh this, it will be very heavy. And if you poke it, some clear fluid will come out of it. Now take this pumpkin. It is yellowish in color. It will be sweet, and it will be somewhat lighter to when you compare this one. Then let us look at this pumpkin. See, it is totally dried up. So this is the same pumpkin, but you see, you can see different dosha predominances. Here it is kapha, here it is pitta, here it is vata, and even we can substantiate our treatment concepts with this. For example, if you want to ripen the pumpkin early, what you will do? You will apply smoke or you will heat it. So ushna is the chikilsa for kapha. If you want to preserve the pumpkin as such now, you will put in the refrigerator. See the is the treatment for pitta. And if someone will give you a dry pumpkin and you ask you to eat, you cannot eat it as such. So you may have to dip it in ghee or you may have to dip it in some oily substance.